Amazing vibes there from Lauren. Hi and welcome. I'm Tristan Hunt, Regional Manager at the Association for Electronic Music, AFM. AFM is a not-for-profit trade association created to represent common interests of those companies and individuals whose business is electronic music and to advocate best practice in the genre. Central to our work is addressing the topic of mental health. Here we provide help and advice to aid mental well-being and help those in the electronic music community who may be struggling. Wherever you are, wherever you're watching this from, if you're facing challenges, know that you're not alone. We hope this session will offer you a little help and maybe some inspiration too. In our Ask the Doctor session today, we're very fortunate to be joined live from California by the renowned industry psychotherapist, Dr. Aida Vazin. Aida, how are you?
Hi, Tristan. I'm doing well. Thank you for the introduction.
Good. You're very welcome. It's good to see you. Can you, before we go on, can you just give us a quick bit of insight into who you are and your background?
Sure. I'm a licensed psychotherapist. I've been in practice since 2006. I have a background in psychology, sociology, cultural anthropology, and human behavior. Needless to say, I love studying humanity. And I specialize in online therapy to help traveling professionals and touring artists stay connected to care.
Perfect. So you're very well positioned to give us some insights and tips today. So I think, like, following the brilliant panel we did at the Amsterdam Dance Event the other day, which was fantastic, that help and advice obviously resonated with an awful lot of people. And today we've been receiving questions from across the Beatport community, with sort of like, some of the most pressing questions that have been coming up to the top of people's minds. If you're happy, shall we begin?
Sure, let's go for it.
Perfect. Okay, great stuff. So one of the most frequently asked questions we've had has been about dealing with the growing feelings of isolation that so many of us are facing right now during the pandemic lockdowns. For some of us, this is worse than sort of pre-existing conditions like anxiety and depression. What advice can you share to help folk watching this to address those challenges?
Sure. I would give two-step advice to this, to the increase in anxiety and depression due to the isolation. One is to normalize it. Feeling more anxious or feeling more depressed during these times is very normal. It's very appropriate. So not to give oneself a hard time for feeling extra or feeling more discomfort. And the second part to that would be practicing the concept of containment. And containment is learning to sit with the discomfort. So, the anxiety or the depression or any other discomfort that's coming up was there before the pandemic. We're just feeling it more because most of our coping tools have been removed from us. And so some of the strongest, most effective coping tools we can use include breath work, journaling, visualization, and meditation, because it doesn't require anything external. It's all internal process. So I would recommend trying some of those tools.
So journaling, visualization, meditation, these are great things, aren't they? Because they're free, essentially, and they're available to everyone.
Right, and especially breath work. I'm a really big fan of breath work because it's the source of life, right? You can go weeks without eating, days without drinking, but only minutes without breathing. And so the breath will always bring you back to the present. And holding our breath or constricting our breath is also a fear response. So if we start going back to breathing normally and regulating our breath, we don't feel as stressed out or as fearful.
Brilliant. That's wonderful. I guess moving on to the sort of second question, and thank you for that fantastic advice. One of the other questions that's been asked a lot, especially from DJs and those working in live events, is how to deal with the anxiety and stress caused by losing work or being unemployed altogether. What advice would you offer people dealing with those challenges right now?
Sure. I think that's really interesting because a lot of the artists I've worked with have been burnt out because of the industry demands and pressures. And then now that there's a big halt, they're really stressed about the future of their careers. So one of the things that I've recommended is to go back to that great connection that the artists have had with their artistry. For a lot of DJs or other types of artists, their source of music, their music was their coping tool, was their outlet. And then it became income source, or it was sustaining their life, and it became a career. I mean, it's a beautiful thing. But during this time where they don't have the pressure to perform, they can reconnect back with that love of their music, the love of their of their art.
Wonderful. So sort of treating like the work side of things to one side, just putting that to one side and just going back into the creative side of it, enjoying that for what it is.
Mm-hmm. And also possibly utilizing it as a coping tool. It's a great outlet. It's a great outlet during these times.
Fantastic. Yeah, and I've been DJing a little bit to sort of express myself and get things out. I can feel that for sure. Wonderful.
Mm-hmm.
So a few more of the questions that we've been having come in from Darth Beats. During the lockdown, as someone who's working full time, probably even sort of more than pre-lockdown, and feeling the pressure to always have to perform, even during a global pandemic, what would you recommend as ways to set clear boundaries to protect your well-being while still maintaining your professionalism?
That's a great question, because there's the one side of the people who aren't working, and there's the other side of the people who are overworking and overcompensating, right? Because we are in such uncomfortable times, and we feel a sense of lack or not enough. We tend to overcompensate as human beings, and sometimes it'll be in that aspect or the area of work. And so it's first recognizing inside where that's coming from, that there's nothing that needs to be overcompensated for right now. And what you're doing is enough. And if more demands and more pressures are being put on you, in a professional way, one can ask, all right, I have all of these on my list I need to do. What would you like me to prioritize first? Or what can I prioritize first? Just chunk it down. You don't have to do it all at once. And that's a really professional way of setting a limit, and also defining it for yourself.
Perfect. Nice and straightforward. Another question that's come in from Nata Daschanter, and apologies if I pronounced your username wrong. So in Germany and many other parts of the world, the sun goes down very early during the winter months, which can be incredibly difficult for many people, especially during the pandemic when you're in isolation. What 3 topic areas of well-being would you recommend to help focus on increasing one's mental health and well-being during these tougher months of the year?
Yeah, and seasonal affect disorder is pretty much what's being addressed there. It's a real thing. Lack of sunlight, does enhance lower moods. And so, this is a great question, and thank you for bringing that up. I would say, especially during these times, focus on 3 aspects: meaning, purpose, and connection. I know it's hard to connect with people, so maybe supplement with obviously virtual connections, or perhaps getting a pet. Right? And that can add a little bit of meaning or purpose, or putting oneself out there in the virtual world, or depending, every place has different rules right now, but being some kind of active member of your society or your community, that will give you a little bit of meaning and purpose during these times as well too.
Perfect, great advice. And Lauren was obviously taking your advice in her set there, because we saw her bring her dog into the end of the set, so she was obviously like dialed into that already, which is great to see. From Lil Potts, Dr. Ida, as a therapist, how do you support your clients through the pandemic whilst you're also experiencing yourself?
That's a really sweet question. I always preach what I put into practice. So I'm a big fan of self-care. I make self-care a big part of my weekly routine, because daily is not feasible for me sometimes. But, I check in with myself. Did I overwork today? Did I need to set a work boundary for myself? Am I stressed out? I scan my body and I'm like, okay, I'm feeling it in my shoulders, or I'm feeling a tightness in my chest, or I'm getting headaches. So maybe it's time to step back and go into my self-care routine. So I just make it a lifestyle to balance out my emotional needs, so I can be there fully for those that I serve.
That's really interesting. That's come up as well. I did an interview with Matthew B. Bushwhacker and also Youssef, and both of those, very well-known, well-established artists said the same thing, that self-care is intrinsic to their work, and they have those healthy habits and routines that they sort of center their lives around. Great advice. Thank you.
Yeah. It works. I mean, it really works. You just have to make it a lifestyle.
Right. Yeah, it's got to be part of what you do, isn't it? We have
Mm-hmm.
from David Pixelate. This is actually for me, but I'm going to pass this over to you because I'd be interested to get your view on it. Maybe I'll give mine as well. So, do you have any tips for staying creative during lockdown? What do you advise your artists?
Oh, I thought that question was for you. Okay.
It is, but I'm throwing over
Tips.
to you.
Okay. Well, again, the breath work and the meditation will help a lot because it will calm down the stress, right? Creativity block is usually exacerbated with stress, right? And so the first thing you want to do is feel safe and relaxed and calm, and then the creative flow can usually come out that way.
I think that's absolutely great advice. And I was going to sort of tail on to what you were saying earlier about going back to not treating it like work, but treating it like fun. This is something that a lot of artists have mentioned to me, actually, which I'm sort of stealing from them. But they say that, you know, the moment you stop treating it like a job, you can go back and you become almost childlike again. You go back with that same curiosity, all of the same things that got you into it in the first place. And that can be a real sort of torch to reignite that creativity.
Yeah.
Okay, let's have a look. So from happyleptic_021. What do you think? Okay, what do you think? How our pets are feeling and coping with this while we're down? So I guess that's sort of like what you were saying earlier about sort of pets being there for us, but how are animals dealing with it? Do you think?
Well, that's a little out of the scope of what I said humanity. But from just observation, you know, pets usually take on our emotions. You know, they
Right.
tend to be quite a strong reflection of where we're at. So of course they're gonna feel the thickness of the tension in the air or the stress in the household. So um, perhaps that might have answered the question partially.
Well, yeah, I'm not a pet expert myself, so I think that sounds good. Moving on, we've got one from Boss Opulent. Um, Are there certain age groups or ethnicities that have a higher predisposition to mental health disorders, like there is with addiction?
Okay, that's a great question, and that's too loaded of an answer to give in just a minute. So I would just redirect the focus more on if someone has a predisposition for a mental disorder. One of the most interesting studies that I've come across were twin studies where identical twins were separated at birth, adopted out to different homes, and they had the same predisposition for mental illness, let's say bipolar or schizophrenia. One that was raised in a harmonious home environment never had florid psychosis or an onset of bipolar disorder, while the other one that was raised in a stressful environment, had an onset of psychosis or an onset of bipolar disorder. So maybe that might be a better answer just for time's sake to know that if we have some kind of genetic predisposition, our environment plays a strong role in how that plays out in our lives.
Sort of coming back to your earlier points about, you know, focusing on ourselves, reducing our stress, but then also like turning out to our environment and trying to keep that environment as stress-free as possible.
Yes.
We have a question from Air_America. What would you recommend for stress, specifically in isolation during COVID time and a lack of social structures, if you have no one with you?
That's a great question. Yeah, and that's been affecting a lot of people. If you can't have face-to-face with people, opt for virtual. If you can allow yourself, or you don't have internal barriers or allergies to some kind of pets, you know, you can even have a pet reptile. If fur is an issue, but like we need connection. You know, it is a core human need to have connection. If you can get out and just talk to a stranger or make eye contact or smile with a stranger or talk to someone in the hospitality or service industry, if you have to get your essentials, something to get your daily dose of human or connection really prioritize that.
Brilliant. We're just about to run out of time, so quickly before we go, we're all dealing with it at the moment. How do you deal with uncertainty during the pandemic?
I like to feel a sense of routine and control, right? We all do. It's not just me. So I make small, schedules for myself, 1 to 3 days out max, because the uncertainty is so high and things change so quickly these days. I'll know how to have my day planned out for today, up to 3 days, and I'll segment it and create a routine and a ritual. Like in the mornings, I wake up and I have my lemon water and I do my breath work, and then I go to the gym or something like that. Like certain things that I know I can expect because I created it that day, and then it'll help me segment to the next part of my day.
That's great advice. Brilliant. Well, look, Aida, thank you so much for your time today and for your insights. I know I found really useful myself. I'm sure a lot of other people will done as well. So thank you very much for that.
Thank you. Thanks for having me.
You're welcome. For more information on what we've discussed today, please visit the links in the chat room, where you'll also find a link to the AFEM Mental Health Guide for the electronic music industry. Check them out. Be well, stay safe. Thank you.